All right, Jan. First of all, I want to thank you for being willing to be in front of a camera and sharing this, not only to patients but also to doctors. I think this is too good to be kept a secret and too good to be hoarded. So this is why I would like to ask you to be natural. It doesn't have to be scripted. It doesn't have to be anything but your story. And your story, among others, will hopefully make a difference and make doctors realize it's something they need to at least give a shot to, and for patients to hear that there's more than just taking a tooth out and putting a piece of metal instead. So from here, it's all yours, Jan. You take it however you want and go on.
I'm so happy for Dr. Nguyen. I'm not kidding you. I cannot say how happy I am. I had a surgery yesterday. I don't feel like $1,000,000, but I feel like $500,000. And I never expected I would. I am so thankful that Dr. Nguyen listened to me, and he was my lucky number 7 consultation, and now I am really confident with his procedure. Everything he said was true. It wasn't a disappointment. It was a success. And I feel so fortunate that I got to have this experience. And who would ever want that? Who would ever want, what do you call it, apioectomy?
That's right. So just to make it clear, it's an apicoectomy or apicosurgery, and you had one like that years ago, right? Am I?
Yes, over 30 years ago, I had it, and it was unbelievable. I missed over a week of work. It was due to a dentist making a mistake and going through to my sinus, and it was a nightmare. I had a really high fever. I had to do emergency surgery. It was horrible healing time. You wouldn't even recognize my face. It was huge. It was huge from all of the trauma that happened. It was a nightmare, and I was fearful of this procedure that I had done yesterday, but I will never fear like again. I can't believe that I'm actually even saying that, because there's no way that I can probably tell somebody who hasn't been through it, but it's like having a baby. You can have the worst horror stories, and then you can have a comeback of how this is just the best. It really was. I just think Dr. Nguyen is a miracle man. Lucky number 7.
Lucky number 7. I remember we talked about this when we first met, and let's talk about the 7 before we go into the actual procedure and you know how that you're here less than a day later and not having too much pain and so forth. But let's talk about the 7. Me being the 7th doctor, I think you wanted to share about that, and I think doctors need to hear this. And
well, that's right. You were my 7th consultation, and when I was at my 6th one, I told him that he was my last hope. I researched on the internet and really, got inundated with information. And anyway, the reason why I ended up coming to see the dentist before Dr. Nguyen was because I found out that he purchased a laser, and that he had a protocol that he did this treatment in order to promote better healing, and to have the bacteria removal, have it be, the area be as cleaned and as bacteria gone as possible. And so when I went to the other dentist, he explained that he had that protocol, but my situation was different because I'd already had some trauma and yada yada. But I ended up being at Dr. Nguyen's, and Number one, he listened. He actually did not dismiss my feelings of pain, and he's Miracle Man. And it's because he believes in thinking outside the box. He's a forward thinker, and he is innovative, and he's open to trying. He must have done that to try the laser kind of ahead of the game, but he's going to be ahead because he is having success with people like me.
And then, by the way, the tooth you came in for isn't the tooth we did surgery on. That was tooth number 1. That's the one that had the mad nerve. And I think everyone before was looking at the small picture, at the teeth that had treatment, and forgot that this wisdom tooth was the one that was hurting you. And so I think this also, doctors need to hear this, is that they need to really have a comprehensive approach to dentistry, not just be small picture.
And one big thing you did that no other one did was the rubber dam. To put that on the tooth, that, to try it out. So yeah, it took more time. You knew it wasn't tooth 2 or 3. Those were treated with a root canal. You knew that tooth 3 had to be it, but to get me to be able to have that pain reproduce it, then you put the rubber dam on, and
That's
then
right.
It did it. It's
That's
like,
right.
I don't know. It's like, okay, it's not rocket science to think of that, but it seemed like it was because no one else was doing it.
May I chime in here? Mm-hmm. So this is for the doctors I've taught before. And by the way, Dr. Smith, who referred you here, is one of them. And I call them the commandos with an E, like the root commandos, So let me just chime in quickly for them. Commandos, you remember what we did at the courses, the rubber dam water test. And that's what I use here for Jan. And apparently it clearly helped her not being in pain now, because we found the tooth that had trouble, and we treated it first before we treated the tooth here with surgery. So 2 different teeth. But if you don't locate the right tooth, doctors, your patient is not going to be helped, and it's a lose-lose.
And the situation too. Okay, so could anyone, your commando people out there, could they be open to, you don't have just one problem, you have 2.
That's right.
It's a possibility. I mean, I couldn't get anybody to even be open to that. And unfortunately, that's what my situation was. It was that I had 2. Ever since I had this, how do you call it,
Apicoectomy?
Okay, years and years ago, I swear the tooth was not right. Mm-hmm. But of course it's not going to be the same as if a treatment maybe hadn't been done, but I definitely haven't been without. So I don't know, it's not the standard that people feel bone pain or infection or whatever, but there was something that was awry. It wasn't right. It's so, I don't know, whatever that's worth too. I don't think it's in my imagination, because I'd much rather do something else than imagine pain.
Well, I'm just glad to see you smile, 16 hours later. That's all. And now let's talk about the timeline, right? So you had an apicoectomy where we made incision through your gums, your bone, and your roots. And could you give us the timeline from when you had it done to now, what you've taken as pain medication, your pain level? This is for patients, not for doctors anymore. This is for patients who are very scared. They hear surgery and they just say, take my tooth out. I want to stop that fear. So with that in mind, please tell the patients what your experience was.
Well, it was, I got in the car at 4:00 and I took 2 ibuprofens. What are those, 200 milligrams? And so it wasn't quite enough. I noticed around 7. I had a long drive home, and I noticed around 7 that I needed a little more. So I took another ibuprofen and a acetaminophen, and then it was under control. I was basically thinking, I'm better. So from 4 to 9:30, I kind of timed it. I was definitely comfortable. Let's put it this way. I was more comfortable yesterday, 4.5 hours after, or whatever that is, 5.5 hours after the surgery, than I was with the root canal tooth that I've been walking around with for several months now. That pain, I was more comfortable than that. So it was, for someone who's scared, who's been through a lot of trauma with their teeth, I don't know. I don't want to say it was nothing, but it was not what I thought it was going to be. I was prepared for the worst.
So if 10 out of 10 was the worst pain in your mind, where were you at the worst yesterday, or the whole time up to now?
I would say my worst pain that I felt yesterday was at the most 4. And it was for very little time.
I see. Okay.
So,
and then you slept through the night?
Yep.
You weren't woken up by the pain or anything
I was
like that?
not woke up by the pain.
Okay.
And I think ice is our best friend. So I am one of those people. I
That's right.
faithfully put it on, took it off. So definitely, I mean, all the things taking place, but I would not think I would be like, you know, doing this little recording right now, because I would think I would need to be recovering, but I instead can go on with my life.
Yeah.
Very happy.
And by the way, this is not magic. This is not a miracle. This is just science. I think doctors are just not willing to listen, and this is why I think having your input will help. You know.
And I think people too, both patients like from my side, they think, well, this procedure is expensive. Oh, and this and that. But I don't know. I kind of teamed it up with how much a car repair bill is sometimes, or all these things. And you use your teeth every day.
Oh, amen to that.
You know, so I know that that's intimidating. The money is intimidating. But if it's at all possible, I think that it's worth it, and you're worth it as a person. And then, like, for the commandos out there that think,
I like that.
I don't want to buy a laser. Oh, it's, you know, and I don't want to go out there and learn it. It's going to cost money, but I think in the end, it'll really be a plus versus a minus, and you'll be ahead of the game. You'll have your own niche. I mean, you know, as far as profit goes or whatever, I would think that would be a plus.
People must think I'm paying you to do this. Seriously.
No, and I know you're not, but we have a business, and we know that it takes the right tools and education and experience to make money.
Right.
And it's just what it is.
But before everything else, let's be clear to whoever will be listening to this. It's about serving the patient, right? It's about the patient first. And again, that's something we doctors are quickly forgetting, or were never taught in the first place, unfortunately.
It's hard because I don't think everybody's in the chair. They don't have that procedure done, but I think that's something that should be taught. I think they teach that in Europe, that kind of like, not really bedside manner, but, you know, they make the doctors go through like an ailment, what it's like to go through, you know, laying in a bed and having everybody wake you up so often to do tests and stuff like that. I think it's important to realize that we're all human, and it could be you next time. And how would you feel if you were just dismissed for your pain? Or
I was gonna say that. How would you feel if you were going from doctor to doctor and they think you're crazy, right? And
well, yeah, and you know, here I am. Each consultation, I'm having to be disappointed that I can't go forward. I was excited to get this appointment and have the surgery done because I'm moving forward, and that meant a lot to me. So I couldn't be happier and feel like it was more successful and relieved than I am really right now.
Jan, thank you so much for, I know it's taking your time, and time cannot be replaced or even purchased. But valuable. Thank you for sharing your experience. I think hopefully we're going to make a change little by little, but I believe this will help patients, this will help doctors, and this will help us as a community overall, you know. And
well, it certainly can't hurt. I mean, you know, and like I said, he said, one seed gets planted, and give it the things that it needs to grow, and keep with what you believe.
Mm-hmm.
You know, if you don't believe in this, don't do it.
That's
because
right.
your heart won't be in it. But I don't know, if you open your mind, there's a lot of things out there to see.
That's right.
Yeah.
Well, go team. Give me a high five right here.
Hey, yeah.
Thank you very much.